Hey, I'm Dr. Sarah Urban. I'm here today to talk to you about chiropractic and acupuncture and how you can use it for pain, stiffness, and overall general health in your pets. So I'm just going to change over the slide. So one of the things we're going to talk about is veterinary spinal manipulation therapy. This is also known as chiropractic in the vet field. Just to give a little background info, chiropractic can be a coined term, meaning that in some states, a veterinarian cannot say that they're doing chiropractic. So in other states, veterinary spinal manipulation therapy is the same. So just to give you a little bit of a background, if you are going to go look for a veterinarian that does this, veterinary spinal manipulation therapy is the same as chiropractic, just to give you a little background on that. So kind of what I just touching about based upon. So the cool thing is chiropractic care is going to involve a very accurate manipulation of joints through a specific plane. So maybe some of you have gone to the chiropractor and you may have noticed that they have to position you in a certain way to get a very quick, non-painful adjustment. We do this the same with animals. Some smaller animals, such as cats or dogs, I might make use of a bail, adjusting bail to sit them up on. Bigger dogs, I can adjust them while sitting in a chair. So those are going to be maybe some of the things that you will see your veterinarian do who's certified in animal chiropractic care. And what it actually is it's a very fast, high acceleration. Okay, so it's very quick moving, but short range thrust. So we're not going to try to, shift a bone way back in place or shift the dog across the room or the cat. It's just a very quick little fast stretch of a joint complex. And the idea behind this is we're actually trying to reset the joint receptors. Okay. And what we're going to do is normalize that joint orientation. So you may have a little joint that hasn't been moving and there might be a little bit of fibrous tissue. I go in there and just do a little boop, and then it allows that joint to slide back and forth. And amazingly, what that's going to allow us to do is help with pain and movement and stuff like that. Okay. So a lot of people will ask, okay, well, why would I want to get chiropractic care or veterinary spinal manipulation therapy for my animals? I had a great mentor, Dr. Carl DeStefano, and we talked about that it's essentially you're taking the smudge off your lens. You could walk around every day, see out of your glasses completely fine, but you say, hey, I could do better. I could clean my glasses. I could get some new glasses. Animals can be walking around with some aches and pains, maybe digestive issues, maybe not sleeping well, some of the cognitive disorders that we're seeing in older patients. And we could do better by them by taking this smudge or taking this interference off of their nervous system, which is beautiful with chiropractic. Okay. One of the things in a term that you may hear with chiropractic is subluxation. Okay. I have a lot of people that come in and say, Doc, just put their bone back into place. It's not quite like that. But for simple terms, the subluxation is there's going to be a loss of a normal motion or position of an individual spinal bone, which can result in numerous health issues. Okay. So if you have an area in the patient's neck, upper cervical, that isn't moving, maybe the dog can move the head to the right, but maybe not so much to the right. And I'll be darned that dog's got digestive issues, has pain in the neck. Some of that could be due to the lack of range of motion on the neck. A lot of times I start looking at vagus issues. But for the sake of this presentation, just in general, we're trying to get those spinal bones, moving a little bit better, getting a subluxation back into place. Okay. And I get asked all the time, why does a pet need chiropractic care? Personally, I love to see my patients before we have a fire emergency kind of going on, or I'm getting a phone call, Doc, can we come in today? I love to try to see them before. But if not, typically when I'm seeing patients for are limping, lameness, honestly, unknown lamenesses, unknown limping that aren't being resolved. We don't have Lyme. They've been already to the neurologist, they've been to the orthopedic, and then a lot of times they go, hey, why don't you try chiropractic? And a lot of times I can get those guys fixed and up and moving. There's a lot of different things that I use it for, changes in behavior. I see a lot of cognitive issues. So kind of like doggy dementia can really help with that. Also aggression. Some dogs will get grumpy if they're not able to move well and do their things that they like to do every day. I see a lot of performance dogs, so agility dogs, tracking dogs, SAR, so search and rescue. I'm seeing a few sled dog, mushing dogs. All of these dogs should be adjusted because they should be treated like an athlete, and they are athletes. So I rather be proactive with them if they're knocking a bar down in agility, especially some of my ones that do kick bite, which is a form of mushing. They might get, ran over a little bit with the bite. So I want to see these guys in for just routine care. And the other thing that is extremely important would be getting your puppies in to see the chiropractor or your veterinarian who's certified in chiropractic. Birth is such a traumatic injury, but it has to be because we want those puppies to get squished out through the canal, get their lungs stimulated to take a deep breath. But as they leave, the birth canal, they're going to get upper cervical subluxations, which could lead to different growth patterns and lamenesses later in life. So super important. I love to see litters come into me. I also like to see, them after a few days of birth and new puppies. So really is beneficial all stages of life. So what exactly happens during a chiropractic adjustment? We're going to break up at some minor adhesions. I'm not looking to move a huge fibrous tissue around the dog's knee or elbow. I'm not looking to break that all up. There's very micro adhesions that might inhibit movement. So it's great to get these moving, little micro scar tissue. We're going to increase mobility and motion in joints. So that's super important. What I absolutely love is this is a very quick, immediate shutdown of pain receptors. So when we adjust, we are actually going to be stimulating very large diameter fibers. So these are going to block pain at the level of the spinal cord, and it happens that quick. So I can adjust and then the pain will be gone from that area. Improved neurological function. A lot of my urinary incontinent, fecal incontinent dogs, this works beautifully. Most of the time they do have something out in their lower spine. It's also going to help with, sometimes dogs with degenerative myopathy. I am careful, I still want dogs to go get worked up and get x-rays and make sure that we're not dealing with something that I can make them worse, such as a tumor or a very traumatic injury. There can be some changes. So it's always important to go get x-rays. I also do this for muscle relaxation. If I have a dog that is just very tight and spastic, stress. And once again, we're looking at stopping pain, which is really important. Okay. So some of the things, I get asked, what exactly is happening during adjustment, and will I hear a crack or a pop? I will say most of my adjustments, I don't hear this. And there is a name for it. A lot of people are like, oh, crack them like I get cracked by my chiropractor. Well, it's not always, it has to happen to make it a good adjustment. And actually the sound that you may hear is called a cavitation. All right. And there's two ways you can have your joint capsule, okay, denoted in this picture. And when we put a little bit of pressure and we're expanding or opening that joint up, it creates basically gas bubbles. And those gas bubbles are going to crack, and that's that noise you hear. The other cause for a cavitation is the synovial lining in that joint. Basically, think about two viscous surfaces, two sticky surfaces are going to be stuck together. When I start expanding them or, kind of opening that joint up, that viscous surface is going to pop open. Okay. So it's not that I'm cracking bones. It's just, it's actual scientific proof. We're either releasing gas molecules or we're, having this viscous surface kind of open up and make that crack sound. Okay. One of the cool things I always talk to my patients about is if I have patients coming in for adjustments, we need to talk about that connection between food and chiropractic care as well. I definitely can see the difference with my patients who are being fed a biologically appropriate diet, either if they're on raw, home cooking, semi-home cooked raw versus like our dry, high processed kibbles. Okay. I'm going to see those dogs a little bit more, deal with more inflammation. So my idea is always when you put garbage in, you're going to get garbage out. Okay. This is going to exhaust our mitochondrial, complexes where they're going to be working hard to try to make energy out of junky material going in. Okay. And believe it or not, when we do a chiropractic adjustment, we change DNA immediately. Nerves will start growing better. Synapses in the brain are going to start, connecting. That's why cognitively it helps a lot of these patients. But you need high quality food to go in to provide new growth. So it also is going to change your gene expression. So if we're not changing how, patients living and how they're eating, you're not going to see that quick change opposed to a dog that is on better food. So it's always something I talk to my patients about when they're coming in for adjustments. Okay. And the big question is like, okay, so what can chiropractic or veterinary spinal manipulation therapy treat? Pretty much everything. I see everything from, just the general stiffness, uneven gaits, kind of like, what is that? I don't know what's going on. Do you see that leg just swing weird? They do well in the show ring, but there's just something still off. A lot of non-responsive disease. I see a lot of internal med cases. Sometimes when the neuro and the orthopods are like, I don't know, go try chiro. I maintain many patients with intervertebral disc disease and keep them comfortable, keep them out from going to seeing the neurologist and having to go on medications. Once again, internal med conditions. If I change how those nerves are firing to the gut, to the liver, to the kidneys, we're going to get better blood flow, and we're also going to be sending signals of how they should function. So I can actually, just by adjustments, change kidney levels, change liver, levels for the better. Geriatric issues, cognitively, just movement all over, health, digestive, making sure that vagus nerve, which is the super powerhouse, it's even back in the day, the Chinese knew what this vagus nerve, because it traversed from your brain, your neck, into your chest, into your abdomen. If you have anywhere along the line spine not functioning well, you may see digestive issues. Okay. Chronic joint pain, a lot of, what this whole coming together as a collaborative of discussing options for discomfort, chronic pain, we can get them off medications. They don't need to live on medications. We can treat them with, great chiropractic care. Different dysplasias, hip dysplasia, elbow dysplasia, just allowing their bodies to move better with what they've been given. Training and behavioral problems. Maybe they're crabby because they hurt. I don't want to be poked or pushed around when my neck's out or my, back's out. Some of our poor development. Once again, if I have a testicle that hasn't dropped, in some of these cases, you get cryptorchid, you can actually do adjustments to help for it to descend. But also it's going to help turn on that gene expression that we were talking about. Repro problems, if your lower back is out, your repro, system is not going to be working properly. If you're high drive, stress, fight and flight, you're not going to want to be making babies when you got to be running from a lion. Okay. And proprioception problems. Just as dogs age, they might lose their sense in their joints of how to move and how to maneuver over objects. So we can help with that with chiropractic. Okay. So we're going to kind of swing over to what is veterinary acupuncture. And then we'll share I have some cases to kind of show you before and afters. And I believe that it was already discussed on what traditional Chinese veterinary medicine is. And we're going to actually dive in and look at what acupuncture is. Okay. So this is just an example of a canine acupressure, but these are the same points that I would needle on a dog. Cats will have very similar, we would say meridians, or points along their body. So it's really interesting that the Chinese knew about this 3,000 years ago. And I looked up, I think PubMed's up to about 14,000 citations on acupuncture now. And close to 600 of those are for veterinarian acupuncture. And generally, what we have is we have these series of lines or channels or meridians on our body. As you can kind of see in this photo, we have these lines. And along these lines, we're going to have points denoted by the name of like GB4, GB29. And so these are sort of connection points within those channels. So I think of it as a power line. We all have experienced that in winter. Our power line comes down, you can't call out. And so what can happen in these channels or meridians is something is disconnected, okay? And what we try to do is by insertion of needles into these specific acupuncture points, we are trying to wake up this channel or move the channel or get it to shift so it works better. Thus, we're going to see improvement in health and stimulate certain channels that may be specific for the bladder, specific for the kidney, the liver, the smelling, things like that. So, okay. Acupuncture is so powerful, and I know I just covered chiro, and I do have some patients that prefer acupuncture over chiro and vice versa. So sometimes I just got done seeing a full day of patients, and most of them enjoy having acupuncture with chiro, but some may just prefer acupuncture. But what I use acupuncture for is going to be arthritis, any of our joint issues work lovely. To get in there and break up, we would say stagnation in Chinese medicine. So think of it as a bruised area that there's some pain, it's just sluggish, the hips aren't moving that well. We want to get in there and get some blood flow moving. This is the same for our lameness. This is also going to be the same for our spinal injuries or conditions that we're dealing with. Reproductive issues, it works great. I have definitely have used it for some of the males, getting older. It's actually heavily used in cows. The warm up, these poor girls are up north in like Vermont. It gets very cold, to warm up the repro tracts to get them bred. It works beautifully for allergies and asthma. I see a ton of asthma cats working on their lungs, opening it up so that they can breathe better. Allergies, I feel like that's probably half of what I see is skin and allergies, but simmering down the itch responses, getting blood flow moving, like blocking some of the itch receptors works great. Chronic pain, I see a lot of patients that are just coming in, pain that cannot be resolved with the traditional drugs, but we can come in and get them acupunctured. And I use a lot of Chinese herbs as well. And we can kind of start chipping away at that and get them a lot more comfortable. I have used it for fractures. Funny enough, when I do use it for fractures, the orthopedic docs always want to know what are they doing, because this is healing a lot faster than it should. Definitely for injuries, I do rehab as well. And so a lot of my shoulder injuries, stifle, ACLs, I'm using it for specifically, non-surgical injuries, but I'm also using it for those healing surgical procedures, such as a tibial plateau leveling osteotomy. I'm using it for patella, back injuries, stuff like that. Okay. So basically, I kind of explained how it works, but we have these little points, and essentially when we stimulate them, we're going to stimulate the nervous system. What it will do is it will actually also release chemicals that are going to affect, can affect your muscles, your spinal cord, and your brain. So those areas will release it, but it's also going to help stimulate them in a good way. Typically we see endorphins, dynorphins. which are natural painkillers. Okay. And in turn, this is going to help because it's going to help with this pain. I actually recommend patients not to be on pain medicine when they come to me, because when they have a natural release of pain medicine due to acupuncture, it's unfortunately going to compete for some of the pain meds that they're on. So they're actually not going to get the best response from the acupuncture. Okay. So I just wanted to share some success stories with you, because I always think it's fun to watch some of the videos instead of you guys hearing me talk. So Grady is a dear patient of mine. He's about a 12-year-old little pitty. He's got a wonderful mom. He's got, I think he's had 7 foreign body surgeries. He's got intervertebral disc basically all along his spine, bilateral severe elbow osteoarthritis. So I'll play this. This is, he was having a hard time walking around, kind of limping as we can see that. It's kind of going in there. And then this is afterwards. I believe this was just one treatment. So he's just cruising along. I actually just saw him today too, which is wonderful. Let me stop that. No, I don't know why it's not letting me click to the next one. All right. And then this is Grace. She came to me. She's a retired agility dog. She's done a lot of sheep herding. She had an acute episode or a very quick onset of vestibular syndrome. So their eyes kind of dart. They kind of feel like they're on a ship that's about to overturn. So this was her. She couldn't walk unassisted. And this was after she came to see me twice. We did acupuncture and chiropractic to get her going, but mostly chiropractic. So big improvements that we saw from her, which was really cool. And then this is Tugger. He was a sweet little guy that came to me. Mom wanted everything, to try to do everything for him. Long story short, he had a little bit of weakness on his left hind leg. Went to a neurologist, kind of the run of the mill, let's do some pain meds and let's just see how he is. And mom was seeking out some care. We did acupuncture and chiropractic on him. So you can see in the first video, he's a little bit unsteady on his hind end. Oh, what's after? All right. So you can kind of see he crab walks there. He just looks like he's going to kind of fall in on that left hind. And he's almost sitting there. And then this was, I saw him twice, and this is his after. So pretty much poor mom was going up the hill with him, but you can see he's just moving out and moving and grooving, and he's pulling on her and he's not sitting back on. So, and so, yeah, just as a recap, I think chiropractic and acupuncture are great modalities. And if you're having any of the issues that we talked about, definitely I would look into them for your animals. But these are just some of the photos of my lovely patients I've had over the years. Thanks so much for joining in.